Hello, Governor, fellow associates, and staff. I want to thank you for the opportunity to come and speak in front of you all today on an issue that I find very important to me. Today, I will be proposing to you all why medical marijuana should be legalized in the state of Nebraska. Currently, 33 states and the District of Columbia have legalized some sort of medical marijuana or recreational marijuana or both. There are roughly over 4 million medical marijuana users across the United States, and there are thousands of Nebraskans that would benefit if it was legalized in Nebraska. Medical marijuana comes in many different forms, including in vaporizers, lotions and oils, or small droplets that you can put under your tongue. Medical marijuana can help a variety of different illnesses and diseases, including Alzheimer's, multiple sclerosis, cancer, appetite loss, and different mental health disorders like chronic anxiety and PTSD. In order to be approved for medical marijuana, you must go through an extensive process of background checks to ensure that you are safe to be taking medical marijuana and to make sure that there aren't any other options for you before trying this. Medical marijuana has a very low amount of THC in it, which is the main chemical in the drug that people use to get high off of. And so to ensure that people don't abuse their medicine and don't get high off of their medication, there is a very, very small dose in there, and it's just the amount that is needed in order to be helpful to the disease and illness that you might have. Some people might say that by legalizing medical marijuana, it would give more access to people that are on the streets looking for it, or it might lead to more legalization of other drugs. However, this is not the case because since medical marijuana is regulated through the government, it is not easy to access at all because you have to go through all those extensive background checks and go through many doctors in order to even have the potential or possibility of getting medical marijuana. People are also drug tested very often to ensure that they aren't abusing their drug because it can always be revoked. There are also plenty of benefits that come along with medical marijuana for patients that are approved to use it. Some of these are that it reduces pain and inflammation, and it is also a big muscle relaxer, stimulates appetite, and it is also seen to kill cancer cells and tumors. I know this firsthand because my mom was diagnosed with multiple sclerosis, or MS, roughly 6 years ago, and it is a disease where it affects one's spinal cord and optic nerves, and it causes trouble with coordination, balance, vision, and muscle control. My mom has struggled to find a medicine that helps her muscles relax before she needs to go to sleep or rest, and after searching for many months, she was found and approved for medical marijuana in the state of Minnesota. She was given a vaporizer that was filled with medical marijuana, and she was able to use that before she needed to sleep and before she needed to rest. She always had to go and check in with the doctors, at least monthly, I believe, and it relaxed her muscles much faster and allowed her to sleep ever better than before. I am proposing to you today that we make a law legalizing medical marijuana because it would benefit thousands of people across Nebraska, and it would allow Nebraska's economy to bring in more money as a result of people buying and having access to medical marijuana. Medical marijuana will protect and enforce our family's health, and what's more important than that? I want to thank you again for allowing me to come and speak on this policy that is very close to my heart and very important to me. Are there any questions?